Now we're going to talk about a very, very important topic, which is wound care. Anytime our infant is cut and they're bleeding, we want to make sure that we properly clean the wound, because proper wound cleaning will prevent our infant from getting an infection. So let's talk about that now. Anytime we are treating someone who is bleeding, we should always put on personal protective equipment. And in this case, it's simply a set of gloves. Now, we want to check our infant, and if our infant is bleeding, then we want to take care of bleeding first. So in the book, we'll go to page 20, which is bleeding control, which you'll learn how to stop all different types of bleeding. But if our infant is not bleeding, or we've stopped the bleeding, then we want to ask ourselves some questions. Is this a puncture wound? And if this is a puncture wound, the only way that we can clean this wound is from the inside out. So we want to gently massage the skin around the wound and allow the wound to bleed a little bit so that it cleans itself from the inside out. After that, we'll clean the area really, really well with soap and water, and then we'll cover it with a sterile dressing, and we'll check it every 6 to 12 hours to make sure it's not getting infected, and we'll put on a clean bandage. If this isn't a puncture wound, if it is a cut, it is a scrape or a laceration or a bite, then we'll clean this by using soap and water. We'll scrub the area really, really well. If this is a cut, then we'll pressure irrigate the cut. And you can do that by using a syringe. Fill the syringe with clean water and then squirt the water into the cut to clean it. We want to clean the area around the cut with soap and water. If this is a scrape, then the wound probably has dirt in it. So you want to pick out that dirt, pick out sand, anything else that's in there, and then clean that wound really, really well with soap and water. For cuts and scrapes, we'll want to cover this cut or scrape with a sterile bandage. And then every 6 to 12 hours, we'll want to take that bandage off. We'll want to check the wound site to make sure it's not getting infected. And then we'll want to replace the bandage with a clean one. If this is a gaping wound or a deep wound or an animal bite, we'll want to clean this area with soap and water, and then we'll either want to call 911 or get our infant to the doctor immediately, because this is a life threat.